Luke is working on a 28 unit case. Let's go here and see what stage he's at.
It's finished the 28 teeth. The combo, aesthetics, the great surface textures, collision contact. So from the 28 unit, which is top and bottom, so all we have made the all porcelain restoration. Not porcelain exactly, is lower, which is we fabricated amber. The cosmic press types, which is top is zirconia, so we get the better corrosion grindiness, more better awareness. So they made two types of the materials. And the beginning we fabricated from the acetate file and then printed and mounted and increased the vertical dimension to allow to make the proper teeth size and also so occlusion contact as well. And then I prep it. You can see these all my preparation. That area, that moment is very important. How much I prepped, where do I have to prep? So here's the things. I'm trying to give you the tips, especially technicians. So whenever we collapse the teeth, so let's say we increase the vertical dimension, right? So we get more room between the teeth. The grinding, I'm talking about the lower, the lingual area only, okay? Do not grind the facial because we have a tons of room. When we bite together, collapse it, increase it, and you see the gap. So my preparation, which is dentist preparation, they have to prep the lingual side only. I'm talking about anterior 6 unit, the lower. So they prep it, which is I did. I just showed this one and a little bit shape down the facial, undercut, eliminated. But upper 6 unit, they grinding more facial as much as possible instead of the lingual because we already opened the bite, so we have enough room.
First we have to take a look at it about the midline, and then the size is too big, trying to eliminate the girly looking as much as possible, just a little bit extended because we open the vertical dimension. So that one is the key. Number one we set up, and then also this at the same time, so I can increase this as lateral, slightly open. Canine, lateral, so trying to make the good proportion of the tooth. Slightly open too. Slightly higher. Now regarding the lower teeth, is make lower higher. Canine as well to get the canine rise and cusp, and the molar just straight, which is trying to make the curve of SB and Wilson together. So here, cusp. This is the design what I fabricated by hand, and then once I set up. And then I match this, all these curve of spears, and then I can increase the vocal corridor, and then trying to get the occlusion contact down to centric contact. So, what is this? Here is what it looked like. It's from the before and after. Exactly what I thought. This is 20 units. Get the occlusion contact. There's also occlusion. There's a vocal corridor. So this is a basic. Midline is off. I have to open it because it opened the vertical. Anyway, this is the final 28 teeth. Trim up and wax up, which is by hand. The diagonal is wax up as well. Okay, this is the upper. This is lower.
And then posteriors, we do have a room, but still I need more room, the posterior, to make the great occlusion anatomy. Sometimes doctor thinks the top and prep has a lot of room, but it's not. Otherwise my crown prep is very flat because once I set up the cusp area and the lack of a room. So I need a little bit more room facial, at least 4mm, that'll be great. And also after wax up, doctors made it temporary in the patient's mouth, and they still not too late. They can see the aesthetic, they can check the contact, occlusion contact, and they can wear it. Depends on how much patient's concern, everything. At least maximum 3 months is better. Otherwise, sometimes they wear the 1 year. It's not recommended. That's not meant to be 1 year for temporary. So Dr. Ho did a wonderful job about the bite because the patient wear the 3 section, okay, 6 unit, 6 unit, 4, 4, 4, 4. So I need a great bite record. Otherwise, I cannot establish the bite. It's very important. What I recommended, so set up the 4 unit, 4 unit, 4 unit, have them bite to get the centric. The other side, same thing. So 3 bite I needed. And I can get the centric bite all temporary fine. I can get the prep the lower bite, but must be very thick, right? This much thick, you need a wax, otherwise not voluminous is not working. So I need another bite, that's okay, but usually that one is not that great. So we're going to do is manually flip, but here will be zirconia. Right after press this one, so we already scan it. That's why you see a lot of powder here. And also made this lower. Okay, so pretty much set up to get the good vertical dimension. Anyway, we received the beautiful case, and then we work with the wax, top, and design both together. Let's set up the lower teeth, the proper contour compared to my wax up, compared to temporary. And then we just give them the more occlusion table, curve of Spee and Wilson, because low jaw only move it. Maxillary top, never move it. So the low jaw have to get proper occlusion contact. Not only that, facial, I need a great aesthetic. Okay, kind of little challenge is a lot of space in between teeth. So regardless is materials, which is I already explained to you, and then we got the same size and they make this beautiful restoration 28. Finished the 28 teeth. The combo, aesthetics, the great surface textures, occlusion contact. Beautiful case, just finish it. Anyway, this is briefly explained, which is what I do, the laboratory technicians, from the dentist, from their prescription pad. So this is what we fabricated in Chicago. So any questions, you can down below, any notes, everything. Any dentist question, you can give it to Dr. Nathan Ho. Patient, contact him so you can talk together. Anyway, thanks for watching my video. Appreciate it. Thank you. See you later.